So what does the governor's orders mean for the county? I spoke today with Jose Arbayo Jr. from the Riverside University Health System. Jose, thanks for joining us again.
Oh, no problem. Sure.
Can you start by explaining what the governor's announcement today means for the county, especially going into the busy 4th of July holiday weekend?
Well, and I appreciate the question. And right now we are working here locally with our administrative staff and our executive office to try and figure out how we're going to move forward. We're going to be working with the state, but clearly there's going to be an impact of some sort on local businesses and residents here in the county on how they can celebrate the 4th of July holiday, whether it's staying at home, which is something we're recommending, and celebrating the 4th with your family that you live with and friends that you live with, or if you're going to be going out, the businesses that you would go to, that you would be outdoors.
And some of the restrictions that the governor talked about, for example, restaurants. He didn't say that restaurants should all shut down. He just said that they should move outside, correct?
Yes, that's correct, along with other businesses. I believe it was also movie theaters, which seems kind of different. We have, I think the wineries and wine tasting facilities, they want them to move outside as well. So it's, the announcement came just a short time ago. So I'm sure there are businesses and municipalities like ourselves that are trying to find out how this is all going to work out.
What about the impact on Indian casinos?
Well, and at this point, from our understanding, we don't work directly with the casinos here, but it seems like they've been exempt from a lot of the orders and recommendations that we've given. I believe that'll remain in place.
What tools does the county have to enforce the orders and restrictions, and has there been sufficient enforcement of the orders, do you think?
Well, one of the things that we always look at in the way of enforcement is we hope that by giving guidelines, strongly recommended guidelines that we have, that a lot of it will be self-policing, where you would have businesses that would see that it's good business to be healthier, to follow the guidelines, and members of the public that see that they have a benefit to wearing the face covering and the social distancing and the frequent hand washing, as we recommend. It's been our hope the whole time that we didn't have to get into issues of enforcement, because then at that point it bogs down. So I think the governor mentioned some things that the state will be able to do. We at the county level have some work through our environmental health department, which would be working with us on the bar closing order that Dr. Cameron Kaiser, our county public health officer, issued on Monday.
Will the county add new enforcement measures or take different approaches with the restrictions?
Well, as I said earlier, that a lot of this is being worked out right now. I know our executive office and our county council and our board of supervisors are right now meeting and discussing ways how we're going to move forward, how we're going to be doing enforcement. I think the governor made a point of saying that is something that they are going to be reinforcing themselves with the municipalities, with the counties, that enforcement is something that is important.
What's the latest with coronavirus in the county? Are numbers still going up?
Yeah, our numbers are still going up. We're going to be getting some new numbers now, but right now we're at 17,296 cases. And if you look at the numbers only 3 or 4 weeks ago, we were at less than 10,000. Our hospitalizations are going up as well, and our use of ICUs, as well as, unfortunately, our deaths as well. So those are all numbers that we did expect an increase as the economy opened and as people began to move around and gather. Maybe we didn't know that it was going to be this high, maybe we did, but I think the important thing now is we're seeing the results of this. So we're hoping that by reinforcing the messaging of covering your face, maintaining social distancing and frequent hand washing, that those simple things, if they were done across the board, I think you'd really see a flattening of the curve. I think people were so happy to be away from the home and being cooped up, I think, that they really didn't follow the safety guidelines that got us to where we were only 3 or 4 weeks ago.
You mentioned hospitalizations. How about surge capacity right now?
Our surge capacity we're doing very well there because, yeah, we are at, as of today, 90% of our ICUs in the county, which is down from 98% just the other day. And we expect it to go down, we hope. But if it doesn't, we still have, we're only just above 60% of overall bed capacity in the county. And as part of our surge plan, we can convert a lot of those beds, a lot of the regular beds into ICU beds, and that would be able to provide a lot more capacity countywide.
Where are we with testing? And does the county think people who are without symptoms should also get tested?
Yeah, Riverside County was one of the first, if not the first county in the state to encourage non-symptomatic people to be tested. We've been trying to get as many people as possible for weeks and weeks now. We're at over 230,000 tests that have been given, and that our per capita is way up there. We're one of the leading, if not the leading counties in the state per capita on testing. We continue to have, I think it's more than a dozen locations in the county that you can get tested at, and it's free or no charge. We encourage people who have symptoms, but also who do not have symptoms, to get tested. So I think if you're a resident of Riverside County and you want to get tested, there's a location near you that you could do it fairly quickly.
All right, Jose, we appreciate your time. Thanks for speaking with us.
Thank you very much. You have a good day.